In this video, we're going to go over 15 essential nursing skills all new nurses should have. Hey everybody, this is Thomas over here at nursemoneytalk.com, and as the intro said, we're going to go over some essential nursing skills that pretty much every new nurse should have, or at least should be thinking about coming into this profession. Now, before I start, I want to invite you, if you find this video helpful, go ahead, hit the notification button, notify whenever we release a new video. Before I start, let me just mention that none of these are in any, particular order by these are the most important and moving down. I'm also not even saying that this is an exhaustive list. So if there is something that isn't included that you feel like should, and let us know in the comment section below. Number one is teamwork. Now there are some facilities where you're going to do team nursing care, where there's going to be a group of nurses taking care of a set group of patients. In a lot of the other facilities, you're just going to have your own assigned patients. Even when you have your own assigned patients, you're still going to have the primary attending physician that's covering the patient. You're still going to have hopefully some techs with you as well, and some other, maybe some RT, physical therapists, and some other members of the multidisciplinary group that's all taking care of this one patient. And that's all a team. And even the other nurses that are there that might have their assigned patients, that might have, their own assigned patients, they easily could have taken care of that patient maybe before, and they might take care of it several days after you do. And even during that shift, I mean, that's a teamwork. That's a team, and it takes teamwork to really make everything go. And the easiest shifts that I have had working as a nurse, even when it seemed like everything was going wrong, codes or whatever, were the ones where it just seemed like everybody was on the same page. Everybody was just working together as a team. So-and-so's patient is calling. They're busy, tied up. I'll hop in there, see what that patient needs. Oh, they need a urinal. They need to help getting to the bathroom or whatever the case is. That really does. It makes such a huge difference in terms of coming to work and coming to a place where you know that you have a team that's standing behind you. The next one is compassion and sympathy. Compassion, you can look at it as having sympathy for one's suffering or pain, and empathy is like the understanding of the just kind of like the trials and the issues, the suffering that person's going through, kind of like the saying, putting yourself in that person's shoe. And in an environment where there's so much pain and so much hurting, I mean, having compassion and really being able to empathize for your patients is so important in terms of the care that you provide. Number three, good communication. As a nurse, you're going to be communicating back and forth with the doctors. Some of your, what you say is going to determine how the treatment goes. You're going to be communicating back and forth with other nurses in terms of the report that you give. You're going to be giving patient education to the patients, either an admit during their hospital stay or discharge. And good communication skills is vital. It is so important that what you say comes out exactly how you wanted it to come out, and then the other person receives it exactly as how you intended for them to receive it. Because poor communication as a nurse can cause so many issues. Time management skills it's no secret that that there's a lot of short staffing situations going on as a nurse, and I mean that's just that's just what it is. And but even still, though, it's important that you learn to prioritize, similar to, you know, in nursing school, where you know, even for those of you that are very far removed, you know, if you're watching this and you're very far removed, but if you're a new nurse, then, you know, you're not that removed from this, where everything needs to be done, but which one needs to be done first, and being organized to where you can hit all of those, you know, hit all of those objectives. Next one, paying attention to details, whether that's the patient's vitals and conditions, or that's just from the medications that you give. Attention to detail can literally be a life or death situation. So it is very important that you pay close attention, that you're able to pay attention to the little details. Next one, professionalism. A good nurse is also a professional nurse as well. And that this, whether that's from how you act, how you treat, you know, other patients, how you carry yourself. And in a lot of ways, that also plays a big role to the public's perception of nurses as well. Next one is critical thinking, which I know it's something that has, you know, that's probably been harped on since nursing school. And you know, critical thinking in the sense of, like, you know, now you're not dealing with, you know, necessarily a black and white situation, but now you're dealing with a whole bunch of gray areas where you really have to critically think and be able to rationalize and take a lot of all these accompanying pieces together to be able to then formulate what your approach needs to be. I mean, and that's you know, that's kind of simplifying, you know, when you're thinking about critical thinking, but it is something that you're going to, it's something that you're going to see, because, you know, you're no longer in that situation where you know, you have, for example, the one patient where they only had diabetes. You know, now, you know, you're going to be in situations where you have a patient who has diabetes on top of heart failure, on top of, you know, maybe, you know, top of maybe cancer or whatever the case is. So all of that jumbled together. And so now you're forced to critically rationalize the decisions that you make. Next one, physical strength and stamina. If you work 12-hour shifts, and a lot of you are going to end up working 12-hour shifts, it's long, and some of you might even end up working 16s. And even if you work just 12-hour shift between, you know, your relief nurse coming in late, or, you know, shoot, something really bad happens, like at the tail end of your shift, falling behind on charting. I mean, 12-hour easily becomes 13, 14 hours just like that. And so you're gonna, I mean, that's honestly, like, it's gonna be exhausting. I mean, it's going to be exhausting, and a lot of your shifts are going to drain the physical energy out of you. And so, you know, you're just gonna have to learn how to, you know, what you need to do to kind of just push forward with that, and just keep moving, honestly. And with that said, that brings me over to the next one, which is your ability to manage your stress, because your shifts are going to push you. It's going to be very stressful. If this is, you know, as a new nurse, you know, with, you know, if you're coming into your first year, I mean, I'm not going to sugarcoat it. It's going to be very stressful, especially if you're going into one of the specialties. It's going to be very stressful. You're going to feel, honestly, you're going to feel dumb in so many different situations, and you're going to walk out of that shift just, and probably even while you're in it, going to be very stressed. And you're going to have to really figure out how to manage that stress, how to not carry it home with you. And it's really important to really start early, trying to figure out what your coping mechanism is, to really prevent nurse burnout from setting in. And I'll put a link to an article just kind of going over stress management and whatnot, and just kind of like some tips there that you can use to try to really cope with just the stressors of being a new nurse. Ethics, being ethical, being an ethical nurse is a big deal. Nurses are continuously voted as one of the most trusted professions in the country, and a lot, and that has to do with just being ethical in your practice, being honest in your nursing practice. The next one is commitment to career development. Healthcare is forever changing. It's always changing. It's quite possible that by the time you're done with your first year as a nurse, that some of the stuff that you learned in nursing school, might be changed a little bit, and that's okay, because all that new research and all that new evidence-based practice that's coming out just improves our healthcare and helps improve patient outcomes. But for some, the downside to that is going to be that you're just going to have to be a lifelong learner. I mean, don't be that nurse that, 10, 15 years down the road, that you're that one who's just set in your old ways that has long been proven to not be good evidence-based practice, and you're still doing it. Just always be about improving your craft with the newest evidence-based practice. The next one is your ability to delegate. Going back to when I mentioned about prioritizing, and that's like, it's really hard to get everything done. And for some, you're going to be in a situation where you're not going to be able to get everything done. And so if you have techs, you need to know what you need to delegate to them. And this is also like if you're in a situation where like you get rotated into a charge position, as a charge nurse, you need to know what you need to handle yourself and what is appropriate for you to delegate to somebody else. And all of that just kind of connects with the prioritizing. It also connects with the managing your stress, because if you're delegating right, that helps to alleviate your stress, because then that means that you're not having to do everything yourself. I'd also made a note to mention about being able to adapt and being able to prioritize as well, but I just want to bring those up real quickly because I know I'd already kind of touched on those in the previous points that I've mentioned, but I do want to emphasize again that just you need to know just how to adapt to the ever-changing landscape of healthcare, and how to really prioritize your day to make sure everything gets done. The last point I'm going to mention is about being strong. I know this sounds a little cliche a bit, and maybe a little bit on the maybe you can kind of relate that a little bit to the physical aspect of it, because when it comes to moving, turning patients or whatnot. But what I was really trying to get to with being strong was the whether it is having a hard conversation with the patient or loved ones, dealing with difficult coworkers or difficult managers, difficult physician or providers, that even in the midst of doing all of that and dealing with all of that, you need to remain strong. Try to remain strong, try to remain confident in what you're doing. And especially, because especially when, you know, other people will feed off of that as well. That's pretty much all I have. Thank you so much for watching, and I'll catch you guys in the next video.